It's just over 12 months now since we started the detailed planning process for our response to COVID-19, and it's been a really difficult year. I think in particular the last 4 or 5 weeks have been very, very difficult across all of our hospital sites. We've seen the numbers of patients with COVID-19 increase quite significantly, and the rate of increase has been very, very rapid. Most of our hospitals are managing outbreaks on their sites, and this puts particular pressure back on services, but also back on staff, where we have seen quite a number of staff being infected with COVID-19 and others being close contacts of people that were infected. I want to thank all staff for the flexibility that you've shown over the recent weeks, particularly to make sure that we continue to provide the best care that we can to patients who use our hospital services. But I also want to thank you for the support that you've shown to each other in what has been a really difficult time. While things do appear to be improving at the moment, our Chief Medical Officer was warning us this week of his concern that the levels of infection in the community are settling at a worryingly high level. I guess what that means for us is that we must continue to do all that we can in the workplace to protect ourselves and to protect each other, but also outside of the workplace to make sure that we minimise the numbers of contacts that we have in order to limit the spread of this virus. We've been rolling out the vaccination programme for COVID-19 since just before the start of this year, and so far it's going well. We have now given a first dose of the vaccination to over 7,900 healthcare workers from across the Saolta group. Over 3,000 people have received their second dose. We are committed to ensuring that all healthcare workers within the Saolta group receive their vaccination as quickly as possible. At the moment, that's dependent on the availability of the vaccine, and we are being told that there will be increased levels of vaccine available as this month progresses. So we've been recruiting additional vaccination staff and preparing our clinics so that when the vaccine becomes available, that we're ready to go and that we can roll out the vaccine quickly.